you very much, Des, and thank you very much for your commitment to making this event happen. I've had an opportunity to get around and meet some of you today. For those of you I haven't, I hope you have a wonderful day, and unfortunately I'll apologise up front that I won't be able to stay for the day. And before I go into what I do wish to say today, I just want to also acknowledge and congratulate MS Australia, who have today been awarded a global award for their MS Brain Health Program. It's amazing, so congratulations. And further to that, we also have in our presence an MS nurse who has also won the global award for that program, Jodie Hudson from Victoria. So well done, Jodie. Thank you. So I'm so excited to see so many people here today, and would like to extend a very warm welcome to each of you, particularly those of you who have travelled from around the state and from interstate. It's very special to have you all here. I'd also like to acknowledge the CEO of MS Australia, Rowan Greenland, my friends Andrew Giles and Andrew Potter, who always keep me in touch with what's going on with MS Australia, Leonie Duff, who will be speaking to us about her lived experience with MS, members of the MS Flagship's Consumer and Community Reference Committee, MS researchers and students from the University of Tasmania and the Menzies Institute for Medical Research, staff from MS Limited, Tasmania and Victoria, and importantly, most importantly, people living with MS and their families, friends and carers, who are what this event is all about. It is indeed an honour to be here today to open the MS Research Flagship event, celebrating the power of connection. I have huge respect for the incredible work the Menzies Institute for Medical Research does for people with MS. I also have a personal connection to MS, so the opportunity to speak to you today has extra significance. My eldest brother, Peter Bushby, who is here with us today, was diagnosed with MS in 1979 as a young, recently married man. Peter and his family have made many changes and adjustments to their lives over the past 4 decades, but this neurological disorder did not stop him from enjoying a full career in real estate and being a doting father and grandfather. I've watched Peter negotiate and adapt to his primary progressive MS since his early 20s, prompting me to actively support and advocate for research in my role as a senator. Together with New South Wales Labor Senator Deborah O'Neill, I co-chair the Parliamentary Friends of Multiple Sclerosis group, which allows us to share insights about MS and research breakthroughs with our parliamentary colleagues. Not only does this group give us the chance to share all the good work being done by organisations like Menzies with our colleagues in Canberra, but it means that I also get insights into upcoming research ideas and treatments. And that is exciting because there is so much good work going on in this space, and you will hear a lot about that today. World MS Day will be marked on Monday here in Tasmania, around Australia and across the world. This is the 3rd year of the World MS Day global theme of connections, which started in 2020 when we were all grappling to understand the impacts of coronavirus. The idea of connection is far-reaching and something that became extremely relevant as we dealt with the effects of the pandemic. As the global campaign has shown us during 2020, 2021 and now into 2022, the idea of connection is vital for those living with MS. Connection involves connecting with yourself, your feelings and your symptoms, connecting with others in your community with MS, as well as carers, family, friends and medical professionals, and connecting with those providing the quality care for people living with MS and the therapies that work for you personally. I know just what a difference connection makes for Peter. I understand the challenges MS presents can leave those living with the condition feeling lonely and socially isolated. I know how important connection is for his well-being. Living close by, I see him frequently, dropping in to share a coffee or a meal with him and his wife Debbie, who's also here today. As a family, we have joined with Peter's friends to form teams at events like the MS Walk, Run and Roll and raise money and awareness for MS research. Unfortunately, we can't be there on Sunday because we have other commitments, but I hope it goes well and it doesn't pour with rain like it did last year. MS connects us and it drives us. Australia's focus for World MS Day next week is on employment and MS, which links to the connection theme via community. I know Peter valued his long-term involvement in the real estate sector and credits his role with keeping him active through his working life. With this in mind, I'm looking forward to the launch of MS Australia's survey on employment and MS on Monday, and the insights it will uncover to make it easier for people like Peter to work with MS. Another reason for my interest in advocating for MS research is that Tasmania has the highest prevalence of MS in Australia. Tasmania's rate is around double that of Queensland, which correlates with our knowledge that MS prevalence increases the further people live away from the equator. This fact is something that impacts thousands of Tasmanians and has far-reaching impacts for our state's health and allied services. What buoys me is the knowledge that people who are diagnosed with this disorder are now benefiting from the remarkable progress that has been made in MS research over the past few decades. When Peter was diagnosed 43 years ago, there was no treatment options and all he could do was manage the condition and learn to live with his MS. But now we have disease-modifying therapies, or immunotherapies, which reduce disease activity in the central nervous system and reduce the frequency and severity of relapses for people with MS. Such treatments mean people who are diagnosed with MS today can hold off disability and keep well for the longer term. Indeed, MS Research Australia's Head of Research, Dr. Julia Moran, told us at last year's World MS Day Parliamentary breakfast in Canberra that the inroads that have been made through research means we can effectively stop MS in its tracks. This research means people are diagnosed with MS earlier now, but disability milestones are reached later and the number of hospitalisations are down. We know about a number of environmental factors that present as precursors to multiple sclerosis, including past and recent sun exposure and vitamin D levels, viral infections, chemical exposures, diet and genetic factors. And the important Australian MS longitudinal study gives us a greater understanding of the condition. This survey is a partnership between MS Research Australia and the Menzies Institute and has been running for more than 20 years. Thousands of Australians, including Peter I think, complete annual surveys to provide real-life data about MS that can be used to inform the need for medical and support services for those with MS and their families and carers. And software has been developed to monitor changes in symptoms between the annual longitudinal study surveys, so we are able to respond to the data presented more responsively than ever. Research done here by our Australian experts has changed the lives of people with MS around the world. We hope that research will lead to more and better therapies, or the ability to reverse the damage this condition has caused. But most importantly, we one day hope there will be a cure for MS. When I return to the new Parliament in coming weeks, actually this next week I'm heading up there, I will continue working to advocate for better services and investment in MS research through the Parliamentary Friends Group. I hope that you all have an enjoyable day today and take the opportunity to connect with those around you. Thank you very much.